All right, one of the most common consultations we get in the hospital is for gallbladder disease or acute cholecystitis or even symptomatic cholelithiasis. So comment gallbladder if you've had your gallbladder removed. So what happens here is we develop gallstones. So this is our gallbladder. This is the liver here. This is the gallbladder. This is the common bile duct. This is the duodenum. What do you got there? And what happens in symptomatic cholelithiasis is that when we eat a fatty or greasy meal, our stomach and intestinal tract is going to produce a hormone called cholecystectomy. Yeah. And cholecystectomy is going to cause the gallbladder to contract. That's why people develop symptomatic cholelithiasis, because when this contracts, one of these stones can get stuck in the neck of the gallbladder, and that could cause postprandial or after you eat right upper quadrant abdominal pain. Now, if that stone gets lodged in the neck and causes the gallbladder to become angry and inflamed, that's when you have actual acute cholecystitis. And now it becomes more of an acute issue. This patient could have fevers, they could have worsening right upper quadrant abdominal pain, they could have a rise in their white blood cell count, and these are the patients where we need to take out their gallbladder more in the acute setting. So what we do, there's also a little artery that comes to the gallbladder here called the cystic artery. So in this operation, we typically do it either laparoscopic or robotic assisted laparoscopic. We go in, we insufflate the abdomen, we take a look at the anatomy here, and we're going to apply 2 clips on the gallbladder, on the cystic duct going to the gallbladder, and 2 clips on the cystic artery, and we're going to remove the organ. And then your gallbladder's out. So that is one of the most common operations that we end up doing in the hospital on acute care surgery call and for the general surgery service. And again, it's a very, very common disease process that we see in our patient population, in a very common consultation that we receive for gallbladder disease.